Dr. Davidson, what would you say concerns you the most when we're talking about the state of youth mental health in Canada?
It's really hard to pinpoint one thing. I think I would come at it from several different angles. So one of the things that really troubles me is the lack of available resources for mental health services for infants, children, youth, and emerging adults in Canada. I fervently believe that if young people have any issues at all, the earlier we can identify them and the earlier we can intervene with them, the better the outcomes would be and the better the life trajectories of our young would be. So I think one of the things is how resourcing in mental health really is insufficient. It's stunning to me, and I did this research using Statistics Canada data. It's stunning to me that from 2003 to 2008 combined, youth were dying from suicide 3 times as frequently as from all forms of cancer combined. And that's not to say that we want some of the cancer resources. It's to say they're really treating cancer really well. And if only mental health had parity in resources with that, I think our young people would be way better off.
So let's take that question and break it apart a bit. First of all, what is contributing to the increase in numbers of youth with mental health issues, in your opinion?
Well, first of all, I think forever, and it's not just in Canada, people with mental health problems have felt quite stigmatized and don't come forward. So it may well be that in 2014, after several years of the Mental Health Commission and various other leaders in the field, parents and families may be feeling more comfortable coming forward and saying, I'm having problems. So in that sense, maybe we've done some destigmatization and increased literacy in mental health, resulting in more people identifying, so that it may not be an absolute increase in the number of people with problems, but rather people who ordinarily would not have presented are now presenting. The other things that really worry me have to do with some of our contemporary ways of being, and I would really want young people to help me out with an answer to this question, but I'll give it a go anyway. So with all of the social media, texting, emailing, tweeting, whatever, I wonder whether we communicate as openly and directly and frankly and supportively as we used to do. I'm quite troubled with social media that in some instances, families don't have a chance to sit together and find out what's going on in each other's lives and support one another as well as they all want to do, because everybody's so busy doing this texting and tweeting and what have you. Mm-hmm. So, I fervently believe that parents always do the best they can, and generally speaking, parents do a really good job. What I hate about my job is how often when parents and their kids come to see me, parents are in anguish about whether there's something with their parenting that has caused the problems their kids are having. And inevitably, the answer is no. Parents have really done the best they can. So The other thing is I think society lets parents down really badly. I think it would be wonderful, not unlike the Right by You campaign, but wonderful if we had parenting programs that parents could take if they wanted to learn more about parenting kids of different ages. And that these kind of parenting courses could be freely available to parents. And in fact, if they took these courses, I really think government should probably be paying these parents for taking the courses. If you think about it, I argue that parenting is the most responsible job adults who decide to have children will ever undergo, and yet it's the one job for which parents have almost no training other than the role modeling of parenting they saw in their own families.
Mm-hmm. Are there any best practices from other countries that you would cite that we could, model this after if it were to happen at one point?
There are best practices. So Triple P is a parenting program out of Australia that's really well developed. But what I would say, Lianne, is that there are all kinds of best practices in parenting that are internationally recognized. Mm-hmm. And I think it would be fairly straightforward to put together a made-in-Canada model that applies to our Canadian culture and to our Canadian parents, all parents, including new immigrants and First Nations parents, French parents, English parents, all parents. And I really think it could make a big difference. Wouldn't it be nice, for example, if, let's say, AJ's kids were maybe 10 and 9, and so she's starting to think about how am I going to parent my adolescent children in a few years' time, and where we could make available to her some kind of course in parenting of adolescent children so that she's prepared ahead of time for her emerging adolescent children. Mm-hmm. So we did it when I was working with the Mental Health Commission of Canada as their chair of the Child and Youth Advisory Committee. We did pitch this idea to government, and government really liked the idea until I get to the point where I say a few things. One, that these parenting courses should be made available in multimedia so that parents can choose their preferred learning style and access the program that way. Mm-hmm. So that's more expensive when it's multimedia. But the thing government really didn't like was I said that at the end of the course, parents should take a little test to demonstrate they've done the course. Mm-hmm. And when they've passed the test, they should get a few $100s from the government as a kind of a carrot to encourage parents to be trained and better prepared for the next stage of parenting.
Right. And when you had presented this, you got a certain amount of feedback. How realistic is it that we would ever see something like that in Canada?
Yeah, unfortunately, I don't think the government will go for that. Mm-hmm. But I think it makes such good sense because if parents are already doing the best they can and they have additional training, then I think the life of families would be considerably better. The communication between family members would be strongly enhanced, and the prevalence of mental health problems for young people would be significantly reduced, and that would allow those young people to better reach their potential. So in fact, even the workplace would be enhanced in Canada if we were able to do this kind of a project.
Let me ask you a bit more about, that whole communication piece. And yes. When you're talking about parents, because one of my questions for you was going to be, what should parents be doing more of? What should parents be doing less of? let's assume that, as you say, most parents are doing the best that they can with what they have available to them.
Right.
When we talk about language and how to speak to our children and, preteens, tweens, and teens and all the rest of it, what language do you suggest needs to be used by parents during these interactions with their children?
Well, first of all, I love your question because you've included all ages of kids. So I think the earlier that, as parents, we can start talking with our kids and making a really open line of communication with our kids, the better. Because as young people get older, their issues sometimes get bigger. And if they're already well-groomed with their parents in having open, direct, and honest communication, then as the issues get bigger, it is easy, relatively easy, for young people to continue to talk openly and directly with their parents. That, I think, is one of the biggest and most important contributing factors that I think as parents we can do. So the earlier we start this, the better, for sure. And then I think it's a matter of using simple language with our kids that they understand and that we understand, and an agreement that if we say anything that's incomprehensible or not understandable, our kids can ask us about that every bit as much as parents. When our kids say something we don't understand, we can ask our kids that. The other thing that I would say is a useful parenting strategy is catching our kids doing things right. Mm-hmm. We're all trained somehow as parents to catch our kids doing things wrong. And what I really would like to see is that for every time I catch my kid doing something wrong, I catch my kid doing something right as well. Mm-hmm. Because that creates the right kind of balance and allows young people to not feel that they are being criticized for everything they do, but also that they're being appreciated for some of the things they're doing.
That's very true. We do focus on the negative, don't we?
Well, we really do. There's a neuropsychologist called Dr. Rick Hansen, and he has a beautiful metaphor, Lianne. His metaphor is that the mind has evolved to a place where for problems and unhappiness, the mind treats that like Velcro. And for happiness, the mind treats it like Teflon. And his concept is that he has 12 pillars that we need to learn in order to reverse that pattern. So that for good stuff and happiness and catching our kids doing things right, that's like Velcro. And for the difficulties and the problems that we all get immersed in, we learn to treat them more like Teflon.
Right. Interesting. So how do you then get the message out for parents to be more, I guess, proactive in their approach to communications with their children so that we're not having these conversations when it in fact is too late for many families?
Yeah, that's another great question. I think the best is if you can start this process when your kids are babies, so that you've got this open line of communication. But it's never too late, in my opinion. So if somebody is listening to this and says, oh my goodness, I don't have the open and direct line of communication I'd like with my 14-year-old, I think there's still a wonderful opportunity to sit down and have a conversation with one's 14-year-old, suggesting that we should together try to do things differently. The important thing is to have reciprocal respect, so the 14-year-old and the parent respect one another completely. They agree to honestly communicate with one another, and anyone can call a meeting anytime, and in addition, I would think that there should be regular family meetings.
Mm-hmm.
And if I may say as well, and this is absolutely not a criticism, it's just a fact of our times, I encounter families far too often actually either never sitting down and having a meal together, or very rarely doing that, and then the people at the meal are often texting or emailing or watching television or something like that, when that family time could be a wonderful opening for open, direct, and honest communication.
Dr. Davidson, is there anything else that you'd like to add?
Just a couple. I want to reiterate a couple of points. So the one thing is that parents truly do the best they can, and maybe society has to do better for parents. That's the one. And the other that I think is even more important is that no matter where things are at between parents and their kids, it's never too late to open the lines of communication. And if parents try to do that and it proves to be difficult, there's always help available, even though the amount of help available is not nearly where we should have it for dealing with the mental health issues of our children, youth, and emerging adults.
Thank you so much for your time.
Totally a pleasure, and I wish you well.